8:11 now. If you frequently suffer from leg pain, discomfort, or fatigue, it's not something that you should ignore. It could be very serious. That discomfort could be a warning sign of peripheral vascular disease, or PVD, a condition in which there is damage or blockage in the blood vessels distant from your heart. This morning, Dr. Charles Leithead, a vascular surgeon at Ochsner, is joining us to talk about the common symptoms and risk factors of PVD. Thank you so much for joining us this morning.
Thank you so much for having me, and this is a very exciting time to educate the public and community regarding peripheral vascular disease, which is the Awareness Month in September. So thank you for having me.
Yeah, well, tell us more about it. Leg pain is one of those things you might think, oh, this is not a big deal. I'm just going to ignore that I'm having it.
Right. The most important thing about peripheral vascular disease is to not ignore your leg pain. Many people attribute leg pain to older age and arthritis. And it's actually could be caused by peripheral vascular disease, which is a narrowing or blockage of the blood vessels outside of the heart. And this is due to a buildup of plaque within the artery called atherosclerosis. Peripheral vascular disease is also known as hardening of the arteries, and it can occur in the arteries of the neck, arms, abdomen, and legs. And due to this decreased blood flow, it can lead to organ damage as well as pain when you walk.
Wow, so very serious there. So, of course, one of the symptoms then would be this leg pain. What else, though, lets you know that it's not just a normal leg pain?
It's usually a pain in the muscle below the area of narrowing or blockage. So that can occur in the buttock, thigh, or calf. It's a burning pain that is reproducible at the same distance each time. It is relieved with rest, and it returns at about the same distance in the same muscle area. If it's not treated, you can progress to decreased hair and nail growth, coolness of the extremities, and it's a spectrum of disease, and you can begin to develop pain at rest, and in the end of the spectrum, you can develop sores, which increases your risk of amputation and infection.
Wow, and so what are some of the risk factors? What's causing this?
Most commonly, patients are older, male gender, have a history of high blood pressure, high cholesterol, diabetes, smoking, lack of exercise, and family history.
And how do you guys screen for this? If someone comes in and has leg pain, what's the next step?
So you should immediately begin to tell your primary care doctor if you have signs or symptoms of peripheral vascular disease. They will seek an early referral to a vascular surgeon, and we will perform a thorough pulse exam. Men and women over the age of 65 years old or anybody with a risk factor for atherosclerosis, smoking, or diabetes should be evaluated for peripheral vascular disease. And we typically start with a pulse exam, and if we have concerns for decreased blood flow, we'll obtain an ankle brachial index. And that's a non-invasive study that we can perform and obtain blood pressure of the legs to give us a range of the blood flow in the legs. We can also perform arterial ultrasound, which gives us a picture of the artery to evaluate any narrowings or blockages, as well as evaluate the speed of the blood flow to see if you have any narrowings.
And then is this something that's curable or treatable?
Yes, absolutely. And early evaluation and treatment by a vascular surgeon is paramount. We can begin with medical treatment, which we typically do in a patient with the leg pain. And as a vascular surgeon, we can treat the patient medically, with minimally invasive procedures, as well as with open surgery. So vascular surgeons can provide all of the care to the patient. So we are able to provide an unbiased, individualized care plan to the patient to treat their particular symptoms and needs and provide them with the best care possible. We will start with medical therapy, and that will be an adjustment of lifestyle modifications, control of comorbidities, and smoking cessation, as well as exercise. There are some medications we can start patients on that help increase the blood flow or open the arteries. We also can perform minimally invasive treatment options that include balloons and stents, as well as open surgery, where we can actually remove the plaque or do a bypass around the narrowing or blockage.
Gotcha. It's great to know that people have options if this is something they're dealing with, and definitely something they shouldn't ignore. Dr. Leithead, thank you so much for joining us this morning.
Thank you so much, and please let us know how Ochsner Vascular Surgery can help you.
All right, thank you. We appreciate it. For more information on peripheral vascular disease or any other heart-related issues, make sure you reach out to the doctors at the Ochsner Heart and Vascular Institute. We posted a link to their website and ours at WWLTV.com. Just look for links on 4. Let's get over to Peyton.